So Freddie Ssengooba, my name's. I work with Makerere University School of Public Health in Uganda, and I'm Associate Professor of Health Policy and Systems Management. Within Rebuild, I've had the privilege of leading one of the strands of research on aid effectiveness in post-conflict settings, particularly focusing on the Uganda situation. In general, this work has had mainly two research questions. One, mainly to understand how the conflicts, response to conflicts in particular, affect the long-term building of the health system, particularly looking at it from aid and how aid, if used early well, could potentially create the conditions for health systems to develop in the long term. So the first question was to understand who are the players, especially in the early phase of post-conflict in northern Uganda, and to see what are the aid relationships these players have, and how do these relationships over time translate into health system developments. In general, we understand that during humanitarian disasters, we have always calls for help, which usually brings in a lot of aid, and that aid goes with many agencies to go and start providing food, water, accommodation, basic needs. And generally, that is a period where there is a lot of international charitable contributions. In general, after a couple of years, when things normalize, we also start to see a change of actors. Many of those that come early tend to pack their bags and go, and that sometimes leaves a vacuum. And then we get a new set of players coming in as development actors who are going to pay or try to design systems for a long term, whether that is roads, whether that is livelihoods, or in the health system trying to construct health centers, recruit staff, and bring in logistics management and procurement. So in general, that is the terrain that we're trying to study. We did this by looking at employing some methodological innovation, borrowing particularly from the social network analysis approaches to see who is connected to whom at this time and at that time, and to see what actually changes over time. And in that, we were also able to design a tool to measure what is aid effectiveness at a subnational level. This work has so far now led to 2 publications, several contributions were made to international conferences, and now in Uganda we are having a regional symposium where we are calling countries that are affected by conflicts, whether those are out of refugees or actual civil strifes, to try and bring them together in Uganda to discuss how, again, we can do better this transition from humanitarian response at the beginning of disasters to how we move into smoothly into the development phase. So in general, what I would say has been the main findings of our work. One was to demonstrate that when you look at service delivery, and maybe try to look at 3 services that we've looked at in 3 districts, we were able to look at what does the network look like in each of these districts that is helping delivery of service. That's a maternal delivery, HIV treatment, and supporting human resources. Interesting in that you see very thick networks of agencies that come together for HIV and maternal health, and generally very thin set of actors coming together to support human resource. Now, if of course workforce is a key element in reconstructing systems in the long term, then that also tells you that these systems are not yet configured to support long-term development. They are more configured on a few services that are required at a particular point in time. And our hypothesis is that when we start to see that these networks are contributing more in a balanced way across districts, but also across services, particularly on the human resource and similar entities, then we'll be able to say there is actually a semblance of systems development. So that work did provide us the insights that more work needs to be put in building or investing in human resource and bringing in funds and agencies whose interests are around supporting things on the systems like medicines, human resource, and other aspects, other than just service delivery as in getting treatment or services for maternal delivery. The other finding we got, or we have at least shared with the general public in publication, has been around how do we measure aid and how is it effective from a subnational level. Those of you listening who are familiar with the aid effectiveness trajectory, there's been a lot of discussion about principles and measures and indicators of aid effectiveness. In general, that has brought a discourse at country and donor relationship to measure how this is working. But many times, many of these aid effectiveness actually is better seen in a conflict and post-conflict setting. How is aid mobilized for humanitarian phase being effectively used, and how does that effectiveness build in also the need for institutionalizing the long-term developments, like putting in place houses for health workers, ensuring their security, bringing in procurement systems and the like. So that tool, we pre-tested it and were able to actually see that can be used and applied elsewhere, and is one of the contribution we provided to the aid industry, especially around health, to try and use this tool to monitor how the relationships between aid actors is happening at different points in different zones, and can be very useful, especially for donors, but also for local governments. The other last finding there, which was important to government when we started sharing these findings, was the fact that they were able to visualize who are the agencies actually on the ground implementing services. Many times, it's very hard at national level to know which agencies are actually doing what in various parts of the country, especially in a decentralized environment. So this tool was quickly picked on by the Ministry of Health, but it should try and complement what they are using right now as league tables to measure district performance. The interesting bit is that those districts where you have so many donors contributing or actors coming on the ground, there are also districts that tended to do well on the national league table. But before this, they were not very able to link why some districts are doing very well. Districts that had been in conflict were always like number one on the league table, and many times that might mean that those districts don't need resources because they are already outperforming others which have not been in conflict, which seemed contradictory. But of course, by looking at the number of actors on the ground trying to improve service delivery, it was very easy to understand why post-conflict districts were always top on the league table, but also to see how the investment of donor relationships can be expanded. Every time a grant comes up, you find actors choose which districts they go to, but sometimes they choose without a criteria. So they go to Gulu, for example, one of the districts we studied with very heavy networks, but they may not go to other districts that have very few actors, meaning that we start looking at these networks of agencies as resources. If they are already too many somewhere, they will probably improve service delivery. But if they are too few somewhere, service delivery will remain behind. So even as a government, you start wanting to see how do we allocate the opportunities and the actors that come on board to ensure that those districts that are not doing well get some affirmative action in the way we allocate agencies to go and work on the ground. So these are some of the areas where we have been able to contribute. We are now analyzing the last set of paper, which is now able to give us what happened in 2013 when we did the first round of survey, and the one that we did towards the end of 2015 to see what happened within that period of almost 2.5 years. The findings currently tell us that even then we see a dynamic change some agencies that were there at the beginning, when they left, you see the networks being slightly dismantled, and particularly donor agencies that in this particular setting were either stopped abruptly or had to stop because their grant period was over. When they move out, they leave the network of agencies a bit fractured, in a sense that fund holders or donors tend to have very many connections to many actors in the region, and when they leave, they create more vulnerability, in a sense that funds disappear, but also the relationship they were able to broker and create a network around, they all kind of get fractured into small separate communities. From health system thinking, we think that that is a way of also making the system more vulnerable by trying to remove central actors or actors that have potentially more connections, and these connections sometimes are about resource flows. So as agencies try to improve health systems functionality in this, it is important to pay attention to how agencies are removed, or as they get removed, how are new ones reintroduced, so that they do not necessarily leave the system more vulnerable, but continue to make them stronger.